We're talking about a groundbreaking development in Denmark that's really shaking up healthcare.
Oh, that sounds fascinating. What's going on in Denmark?
So, get this. Emergency nurses in Kolding municipality have become the first in Europe to be certified to perform focused lung ultrasound scans, or FLUS, in patients' homes.
Wow, they're actually doing lung ultrasounds at people's homes? That's
Yeah,
incredible.
yeah, it's a huge step forward. And the best part is, combining these scans with venous blood tests has reduced mortality by over 50%.
Over 50%? That's amazing. How did they manage that?
Well, it's part of a PhD project by Dr. Osmarck. She aimed to see if increasing diagnostic tools in primary care could, help catch illnesses earlier in elderly patients.
So they're basically arming nurses with more tools to make better diagnoses on the spot?
Exactly. Instead of just measuring blood pressure, temperature, and so on, they can now perform ultrasounds and take venous blood samples right in the patient's living room.
That's like bringing the hospital directly to the patient. It
Yeah,
must make a huge difference for the elderly who have difficulty getting to the hospital.
definitely. And you know, elderly patients often have atypical symptoms. They might not show the usual signs of, say, pneumonia.
Right. They might not have a fever or a cough, even if they're seriously ill.
Exactly. So having these diagnostic tools allows nurses to detect conditions like pneumonia much earlier.
That's fantastic. But, how did the nurses react to this new responsibility?
Well, one of the nurses, Tina Elgård Clausen, admitted she thought it sounded difficult at first. But after thorough training, she found it wasn't that hard and was excited to have more tools to help patients.
That's great to hear. It's like giving them superpowers to better care for their patients.
Yeah, and it really empowers them in their roles. They can make more informed decisions about whether a patient can stay at home or needs to be hospitalized.
But did this reduce hospital admissions as well?
Surprisingly, it didn't reduce the number of admissions.
Really? That's interesting. I would have thought fewer people would need to go to the hospital.
You'd think so. But the key here is that the right people are being admitted at the right time.
So it's more about improving the quality of care rather than just cutting down numbers?
Exactly. Early detection means treatment can start sooner, which reduces mortality significantly.
Over 50%, you said? That's huge.
Yeah, it's a 56% reduction in mortality, to be precise.
That's like, saving more than half the lives that might have been lost otherwise.
Precisely. It's a massive improvement.
So how exactly do they perform these ultrasounds in a home setting? Isn't the equipment bulky?
Actually, the ultrasound devices they're using are quite portable. They fit into the nurses' kits alongside other equipment.
That's so cool. Technology has really come a long way.
It has! And the nurses received comprehensive training, including e-learning, virtual reality, and supervised practice to get certified.
Virtual reality training? That's impressive.
Yeah, they wanted to ensure the nurses were fully prepared. And they even had support via tele-ultrasound if they needed real-time assistance during a scan.
So they weren't just thrown into the deep end. That's
Exactly.
important for patient safety.
Absolutely. Patient safety was a top priority, and the nurses felt it enhanced their professional skills and confidence.
I can imagine. But do you think this model could work in other places?
I think so. It could revolutionize how we approach primary health care, especially for the elderly or those with mobility issues.
But are there any challenges you can see in implementing this elsewhere?
Well, it does require investment in equipment and training, and there might be regulatory hurdles in some regions.
Right? And perhaps some skepticism from healthcare professionals?
Possibly, but the results speak for themselves. Reducing mortality by over half is hard to ignore.
True. Maybe it's time for the rest of Europe and the world to take note.
I agree. It's like when smartphones first came out. You know, at first people were hesitant, but now we can't imagine life without them.
Haha, that's a good analogy. So what's next for this project?
Well, the research included 3 studies, and the hope is to expand the use of FLUS and venous blood tests in primary care.
It could become a new standard of care.
That's the goal. And with the positive outcomes they've seen, it's a realistic one.
This has been a really enlightening discussion. It's inspiring to see such innovation in healthcare.
Absolutely. It's really a testament to what can be achieved when we empower healthcare professionals with the right tools.
Couldn't agree more. Well, thanks for bringing this topic to the table today.
My pleasure. always happy to share exciting advancements.
And thank you to our listeners for joining us on the Hey Gen podcast. Until next time.